We've got a couple of things to talk about. In November, we have Family Caregivers Month and Lung Cancer Awareness Month. And joining us, the Senior Development Manager with the American Cancer Society of Northwest Ohio, Cheryl Eddy. And thanks for joining us, Cheryl.
Thanks for having me.
Okay, so this month, it is nice to highlight caregivers because they're so important and they have a big job.
They are. Caregivers, it's a position you're put into when you're not really expecting it, but you step up because no matter what stage of your cancer journey, caregivers have the biggest influence on their loved ones to cope with the illness. And we just appreciate caregivers and appreciate all you do. They are with someone who's diagnosed with cancer every step of the way. And we do have some resources. If you visit cancer.org/caregivers, caregiving is something that is very strenuous on you, and we don't want you to get burnt out. And we do have resources for you, and we have people there to talk to, and that can help you along the way so you can stay strong for your loved one.
That's awesome to have that little bit of support. Okay, so let's also talk about this month is Lung Cancer Awareness Month, and I assume there are some obvious risk factors then for lung cancer?
Yeah, so lung cancer, don't smoke. If you do smoke, try to quit. Secondhand smoke is really bad. Try avoiding all tobacco products altogether if you can. And there are some things that is not preventable with lung cancer, which is also scary. And that might be your age, some health history, some cell mutations. So it is important to really be open and honest with your doctors and tell them about all your history, if you are a smoker or not a smoker, and find out when and what type of screening is best for you.
Yeah, are there different screenings then for lung cancer now?
There are a couple different ones. There's a CT one that is very like a low radiant one, and then there's some other cell like blood genetic ones that you can get to see like what your risk factors were. But really, we really encourage people, especially if you are a smoker, to start talking to your doctor and start getting screened at the age of 50. Most diagnosis with lung cancer is about the average age of 70. Some are in the 40s, which is rare, but it does happen. So it is really something to be concerned about. And if you are a smoker, please, please, please just try to stop.
Right, yeah, exactly. That seems like the biggest thing. So are there any signs and symptoms that you might, hey, I maybe need a screening, or there might be something up with my lungs?
Yeah, if you have a cough that just really doesn't go away, or if you're prone to getting pneumonia and have bronchitis that just you can't treat and can't get to go away, you have loss of appetite, loss of energy, just some different things that your body just seems off, that something is wrong and you're not quite sure what it is, really go to your doctor. If you have like a hoarse voice and just really feeling blue, go to your doctor, talk to them. Those could be underlying symptoms that they really need to know about.
Right, yeah. And as most cancers, I assume, do this kind of stuff early, because if you catch it early, there are better outcomes.
Absolutely, yeah. Don't be scared of the doctor. Be open and honest with them, and definitely get screened. Screening gives the best chance and overall rate for everything.
Right, exactly. All right, well, thank you very much, Cheryl, for talking with us today about lung cancer awareness and family caregivers.
Thank you very much.
All right, don't go away. Noon Edition continues in a moment.